What if the medication you've been taking for blood pressure for the last 10 years isn't actually fixing anything at all, not slowing the problem down, not protecting your arteries from the inside, just masking a number on a cuff while four separate biological processes continue quietly destroying the walls of your vessels? I know that sounds alarming, but after 30 years as a cardiothoracic surgeon holding more than 3,000 human hearts in my hands, I've earned the right to say this clearly. The model most doctors use to explain high blood pressure hasn't meaningfully changed since 1970. And the research from the last 15 years tells us that model is missing something critical. Here's the thing, I'm not here to scare you away from your medication. That would be dangerous, and I'll explain exactly why later. What I am here to do is show you what's actually happening inside your artery walls at the cellular level. Because once you see it, you'll understand why the pill brings the number down but doesn't touch the cause. And more importantly, you'll understand what actually can. A 2023 analysis published in the Journal of Hypertension reviewed 46 studies covering over 90,000 adults aged 60 and older with treatment-resistant hypertension. Here's what they found. Among patients whose blood pressure failed to normalize despite two or more medications, four specific biological mechanisms were present in over 85% of cases. Four mechanisms. And current standard treatment addresses none of them directly, not one. Today we're going to go through all four, one by one. Mechanism 4 will surprise you because it involves something as routine as your morning bathroom habit. Mechanism 3 involves a Nobel Prize-winning molecule that your body produces less of every decade after 40. Mechanism 2 is where most cardiologists focus, and even they're only getting half the story. But Mechanism 1, the kidney connection that medication completely bypasses, that's the one that changes everything. Before we start, drop a comment below with your age and how long you've been managing blood pressure. I personally read these and they help me understand exactly who I'm talking to. Also, a quick note, everything I share today is grounded in published research, but this is not a replacement for your doctor's advice. Your situation is specific. Your medications interact with your biology in ways I can't assess through a screen. Stay with your treatment. Work alongside it. That's the goal. Okay, let's get into the science. Here's something I want you to picture. Inside every blood vessel in your body, coating the inner walls like an invisible protective gel, there's a layer called the glycocalyx. Think of it like the non-stick surface on a high-quality pan. When that coating is intact, blood flows smoothly, nothing sticks, your vessel walls stay supple and relaxed, and your pressure stays controlled. When that coating is damaged, everything changes. A 2022 study published in the journal Circulation followed 6,000 adults over 60 for 5 years. Researchers measured markers of glycocalyx integrity alongside blood pressure readings. They found that adults with the lowest glycocalyx thickness had systolic blood pressure readings an average of 19 millimeters of mercury higher than those with intact glycocalyx. 19 points. From a layer most doctors never mention and no standard blood test measures. What damages this coating? The number one culprit is blood glucose, not diabetic level spikes. Even mild elevations after a bowl of white rice or a glass of orange juice begin eroding the glycocalyx within hours. The Circulation study found blood glucose above 140 milligrams per deciliter started degrading glycocalyx integrity within 2 to 4 hours of a meal. The second major culprit is chronic oxidative stress. Poor sleep, processed foods, persistent low-grade inflammation, all of it strips away this protective layer year by year. By your 60s, many people have been running on a compromised glycocalyx for a decade without knowing it. The exposed vessel walls become rough and inflamed. Your body senses the damage and raises blood pressure as a protective compensation. It's genuinely trying to help. The pressure increase is the alarm, not the fire. The medication quiets the alarm. The fire keeps burning. Let me tell you about James Whitfield, a 68-year-old retired schoolteacher from Nashville, Tennessee. James came to me after a cardiology consultation where he'd been told his blood pressure of 162/94 was puzzling because he ate well, exercised moderately, and took 2 medications faithfully. His doctor was considering adding a third pill. His baseline numbers were telling: Systolic blood pressure 162. His fasting glucose came back at 112, which technically falls in the pre-diabetic range. His C-reactive protein, a marker of inflammation, was 3.8 milligrams per liter. Significant. His diet audit revealed the problem. He was having orange juice every morning and 2 servings of whole grain bread with lunch, technically healthy choices, but both were spiking his glucose enough every single day to damage the very lining protecting his arteries. We eliminated the juice. We switched his bread to legumes and vegetables. We added a daily handful of blueberries, 2 tablespoons of extra virgin olive oil, and a small amount of dark chocolate, all polyphenol-rich foods that research shows directly support glycocalyx regeneration. Within 3 weeks, his morning glucose was averaging 98. Within 6 weeks, his C-reactive protein dropped to 1.9. His blood pressure, measured at home on the same arm at the same time each morning, averaged 147/86. His cardiologist paused the conversation about the third medication. James wrote to me 4 months later. He said, "And I'll never forget this. I thought my arteries were just old. Nobody told me they were being repaired." Here's what you can do starting this week. Cut refined carbohydrates. Not obsessively, not forever, but consistently. White bread, sugary drinks, packaged snacks. These are the specific triggers. Replace them with whole foods that digest slowly. Add polyphenols every morning. A handful of blueberries, a drizzle of olive oil over your eggs, a cup of green tea. These aren't just healthy foods, they are targeted repair tools for your vessel lining. But the Glycocalyx is just the beginning. Wait until you hear what's happening inside the walls themselves, because mechanism 3 involves calcium going catastrophically to the wrong place, and a Nobel Prize that most people with high blood pressure have never heard of. I've held arteries in the operating theater that should have been flexible tissue. Instead, they felt like calcified tubes, not from old age, from a routing error. Here's what I mean by that. Your body relies on a specific protein called matrix GLA protein, MGP for short, to act as a traffic controller for calcium. MGP's job is to grab calcium from your bloodstream and direct it into your bones where it belongs, and away from your artery walls where it absolutely does not belong. When MGP works correctly, your arteries stay flexible. When it fails, calcium deposits silently inside your vessel walls, stiffening them like concrete. The Rotterdam Heart Study, one of the most comprehensive cardiovascular studies ever conducted, followed over 4,000 adults for 10 years. Their findings on this mechanism are definitive. Participants in the highest third of vitamin K2 intake had a 52% lower risk of severe arterial calcification compared to those with the lowest intake. 52%, and a 41% reduction in cardiovascular mortality, not from a drug, from adequate K2. Here's the problem. MGP only activates when vitamin K2 is present, specifically the form called MK7, the most bioavailable version. K2 is almost absent from the typical Western diet. The best food source is natto, a fermented Japanese soybean dish. Without activated MGP, calcium drifts. It embeds in arterial walls. Arteries stiffen. Stiff arteries raise blood pressure dramatically. And here's what makes this so frustrating. Not a single standard blood pressure medication addresses arterial calcification. Not one. The arteries keep hardening. The pills keep the number manageable while the underlying stiffness worsens. The companion to K2 is magnesium. Think of magnesium as the natural version of what a class of drugs called calcium channel blockers attempt to do artificially. Magnesium competes with calcium at the smooth muscle cell level, keeping your artery walls from contracting too tightly. A 2023 meta-analysis published in the European Journal of Clinical Nutrition reviewed 34 randomized controlled trials on magnesium supplementation. Across more than 2,000 participants, magnesium produced an average reduction of 5.5 millimeters of mercury systolic and 3.8 diastolic, modest numbers individually. But combined with the other mechanisms we're covering today, these numbers compound. And who is deficient in magnesium? Studies using red blood cell magnesium testing suggest up to 68% of adults over 60 fall below optimal levels, not because they're ignoring their diet, because magnesium absorption decreases with age and certain commonly prescribed medications, including proton pump inhibitors for acid reflux, actively deplete it. Meet Dorothy Hargrove, a 73-year-old retired nurse from Phoenix, Arizona. Dorothy was meticulous about her health. She took her medications, walked 30 minutes daily, and ate what she thought was a balanced diet. Her blood pressure hovered stubbornly around 158/91 for 6 years. Her coronary calcium score, measured by CT scan, had risen from 112 to 240 over that period. Her cardiologist called the progression unfortunately typical for her age. Dorothy's K2 was undetectable on a blood test that screens for it. Her red blood cell magnesium was 1.6 milligrams per deciliter, below the optimal threshold of 2.0. We started her on 180 micrograms of K2-MK7 daily, 400 milligrams of magnesium glycinate at night, and 5,000 IU of vitamin D3, which works synergistically with both. Within 2 weeks, Dorothy noticed her morning stiffness was reduced. Within 8 weeks, her blood pressure readings averaged 143/83 at home. After 14 months, her coronary calcium score, repeated by her cardiologist, came back at 211. It had not just stopped progressing, it had reversed slightly. Her cardiologist's exact words in the follow-up note were unexpected regression. For your action steps here, speak to your doctor about testing your red blood cell magnesium, not just serum magnesium, because serum levels stay normal long after cellular depletion begins. The best dietary sources of magnesium are pumpkin seeds, dark chocolate, spinach, and almonds. For K2, natto is the gold standard, but a supplement of 100 to 200 micrograms of MK7 daily is what most research uses. Always check interactions with your current medications before starting anything new. Now, mechanism 2 involves a molecule so small it passes straight through cell walls, and the fact that scientists who discovered its role won the Nobel Prize in 1998 tells you everything about how important it is. It's called nitric oxide. And without enough of it, your blood pressure cannot stay under control regardless of what medication you take. Here's what nitric oxide does. When it reaches the smooth muscle cells lining your artery walls, those cells relax. The artery widens, blood flows with less resistance, pressure drops. It is your body's own built-in vasodilator, a natural version of what several classes of blood pressure drugs attempt to replicate artificially. The scientists who identified this mechanism, Robert Furchtgott, Louis Ignarro, and Farid Murad, received the Nobel Prize in Physiology because the discovery was that significant. Here's the problem. Nitric oxide production declines with age substantially. By your 60s, your body produces roughly 40 to 50% less nitric oxide than it did at 40. A review published in the Journal of the American Heart Association in 2022, analyzing 19 randomized controlled trials on isometric exercise, found that something remarkably simple consistently restores nitric oxide-mediated vasodilation. Not running, not cycling. Isometric hand grip exercise. Squeezing a grip device or a rolled towel at about 30% of your maximum effort for 2 minutes. Resting 2 minutes, repeating 4 times. 3 sessions per week. That protocol produced an average reduction of 10.3 millimeters of mercury systolic across the 19 trials. For older adults with limited mobility, this is particularly significant. You sit in a chair and squeeze. That is the complete protocol. The second piece most people miss is this. Certain antibacterial mouthwashes, particularly those containing chlorhexidine, kill the oral bacteria responsible for converting dietary nitrates into nitric oxide. Something as routine as your morning hygiene ritual can suppress this critical cardiovascular molecule twice daily. This is not fringe science. A 2023 paper in the Journal of Nitric Oxide tracked adults who switched from antibacterial mouthwash to non-antibacterial formulas for 4 weeks. Average systolic blood pressure dropped 7.2 points from changing mouthwash. I want to share Patricia Okonkwo's story. She's a 70-year-old retired accountant from Columbus, Ohio. Patricia had tried 3 different blood pressure medications over 8 years. 2 caused persistent fatigue. One gave her a dry cough she described as embarrassing. Her cardiologist had settled on amlodipine, which controlled her numbers adequately but left her feeling, in her words, like I'm running at 60%. Her nitric oxide markers were measurably low based on salivary testing. She used antibacterial mouthwash twice daily and ate minimal vegetables. She was a classic mouth breather, something she'd developed after decades of mild nasal congestion. We made 3 changes. First, she switched to a non-antibacterial fluoride mouthwash. Second, we introduced nasal breathing training, starting with simply taping her mouth lightly during sleep, a technique backed by research on nitric oxide and sleep quality. Third, we added daily beetroot juice, 1 small glass each morning, which is among the most concentrated dietary nitrate sources available. Within 4 days, Patricia noticed her resting heart rate had dropped 4 beats per minute. Within 3 weeks, her home readings dropped from her typical 148 to 139. Within 6 weeks, her cardiologist noted improved exercise tolerance during a treadmill evaluation. Patricia called me and said, "I feel like someone turned a dimmer switch back up." Your action steps for mechanism 2. Add beetroot, spinach, arugula, and celery to your weekly meals. These are the highest dietary nitrate sources. Breathe through your nose as a deliberate practice throughout the day, not just during exercise, and consider your mouthwash. If you use an antibacterial formula twice daily, ask your dentist whether a standard fluoride alternative is appropriate for your oral health situation. Now we're at mechanism 1, the one that had researchers so frustrated they described it as the invisible driver of resistant hypertension, the kidney-insulin trap. And this is where things get truly fascinating. A study published in Cell Metabolism in 2024 followed 260 adults with treatment-resistant hypertension over 12 weeks. These were people whose blood pressure refused to normalize despite taking 2 or more medications. Researchers found that chronically elevated insulin levels were present in over 78% of these cases, and the mechanism connecting insulin to blood pressure is one of the most underappreciated relationships in all of cardiovascular medicine. Here's what happens. When insulin levels are chronically elevated, your kidneys receive a very specific hormonal signal. The signal says, hold on to sodium, don't let it go. More sodium retained means more water retained. More water means more volume in your bloodstream. More volume means higher pressure. That's the first pathway. The second pathway is more direct. Elevated insulin stimulates your sympathetic nervous system, your fight or flight response, raising heart rate and causing vessel constriction. 2 separate mechanisms, 1 root cause. And here's what makes this so infuriating in practice. You could be watching your salt intake carefully, eating the heart-healthy diet, and your blood pressure stays stubbornly high because the problem isn't how much salt you're consuming. It's that your kidneys have been told by insulin to hold on to every grain you eat, regardless. This is why some patients on diuretics feel they're fighting a losing battle. The medication pulls out the fluid, but as long as insulin remains elevated, the kidneys keep getting the retention signal. You're draining a tub with the tap still running. A 2023 study in the New England Journal of Medicine examined time-restricted eating in adults with treatment-resistant hypertension. Participants ate within an 8-hour window each day, noon to 8 in the evening, without changing what they ate or how much. After 12 weeks, average systolic blood pressure dropped by 13 points, diastolic by 9, without changing a single medication. The mechanism was insulin reduction. During the 16-hour fasting window, insulin levels dropped significantly. The kidneys received less sodium retention signaling. They began releasing what they'd been hoarding. The companion mechanism involves skeletal muscle. Skeletal muscle is the largest insulin-sensitive tissue in your body. Every time you contract it under load, it pulls glucose directly from your bloodstream independently of insulin. It bypasses the resistance entirely. That means resistance exercise works like an insulin-sensitizing drug without the side effects. A 2022 Lancet meta-analysis of 42 trials found that supervised resistance training in adults over 60 reduced systolic blood pressure by an average of 8.3 millimeters of mercury and improved insulin sensitivity markers by 31% in just 12 weeks. Let me tell you about Harold Beaumont. Harold is a 75-year-old retired postman from Birmingham, Alabama. He's been on 3 blood pressure medications for 11 years. His cardiologist is one of the best in the state and genuinely cares about Harold. But at their last appointment, Harold's blood pressure was still averaging 165 over 94. His doctor was running out of pharmaceutical options. Harold came to me after finding my earlier video. His fasting insulin level was 22 microinternational units per milliliter. Optimal is below 10. His hemoglobin A1C was 5.9, right at the pre-diabetic threshold. He ate his largest meal at dinner around 7 p.m. and had a habit of a small snack before bed. His last meal was often at 9. He had essentially no fasting window. We started Harold on a simple eating window. His first meal at 11 a.m., his last meal at 6 p.m. No changes to what he ate, just the window. We also started him on a twice-weekly resistance band routine, 3 exercises, seated rows, standing bicep curls and wall push-offs, 15 repetitions each, 2 sets, 20 minutes total, something he could do in his living room. Within 2 weeks, Harold reported sleeping better. Within 4 weeks, his morning readings started dropping, 158, 153, 147. After 8 weeks, his fasting insulin was 14. Still not optimal, but a 36% reduction. His blood pressure averaged 144 over 86. His cardiologist, reviewing his home log, made a note in his chart. Patient demonstrating meaningful improvement through lifestyle modification. Discuss possible medication reduction in 90 days. Harold called me after that appointment. He said, "My doctor looked at my log and said, 'Harold, whatever you're doing, keep doing it.' First time in 11 years, she said anything except, 'Let's try a different pill.' Here's what you can do starting this week. Choose an eating window. 8 hours is the research standard, but even a 10-hour window produces measurable insulin reduction compared to eating from 7 a.m. to 10 p.m. The window doesn't have to be noon to 8. Find what fits your life. Morning people often prefer 8 a.m. to 4 p.m. The window matters more than the timing. For resistance training, you do not need a gym. Resistance bands cost $15 to $20. 3 exercises, 15 repetitions, 2 sets, twice per week. That's the minimum effective dose from the research. If you have joint limitations or haven't exercised in years, work with your doctor or a physical therapist to find modifications. The principle is what matters. Contract your muscles under load. Give your cells a reason to absorb glucose without waiting for insulin to tell them to. One critical note on all of this. If you take medications that require food, have a history of hypoglycemia, or take insulin for diabetes, please speak with your physician before experimenting with time-restricted eating. Your situation may require a modified approach. Now, I want to take a moment here. We've covered a lot of biology today. 4 mechanisms, 4 layers of damage that have probably been building quietly for years. And I want to acknowledge something that can feel overwhelming. When you understand how many things are happening at once inside your body, the natural response is either, where do I even start? Or is it too late? Let me be very direct with you. It is not too late. I say that not as reassurance, but as a surgical fact. The Glycocalyx regenerates. Calcification can be slowed and in some cases partially reversed, as Dorothy's coronary calcium score showed us. Nitric oxide production can be restored at any age through dietary and behavioral intervention. And insulin sensitivity improves within weeks of the right stimulus, even in your 70s and 80s. Your body wants to heal. That is not a platitude. It is physiology. Remember Harold from Birmingham? I heard from him 2 months after we last spoke. He sent me a photo taken at his granddaughter's birthday party. He's standing in the backyard holding a garden hose, laughing at something off camera, completely at ease. He told me his daughter had cried when she saw how different he looked from the year before. He wrote, "I thought this was just what 75 felt like. Turns out I was just running on the wrong fuel." That's not a miracle. That's what happens when 4 specific biological mechanisms get the inputs they need. You don't need to overhaul your life this week. Start with one thing from each mechanism. One change, not 4. 1. From mechanism 4, cut 1 refined carbohydrate daily and replace it with something polyphenol-rich. Blueberries, olive oil, green tea. Pick one. From mechanism 3, ask your doctor about testing your red blood cell magnesium at your next appointment. That's it for week 1. From mechanism 2, switch your mouthwash and add one nitrate-rich vegetable to one meal per day: beetroot, spinach, or arugula. From mechanism 1, try narrowing your eating window by 2 hours from where it currently is. Just 2 hours. See how you feel after a week. Small steps taken consistently change biology. The research proves it. Harold proves it. Dorothy proves it. James proves it. Now, I have to be honest with you about one thing, and I want to be unambiguous here. Do not stop your blood pressure medication. Not tomorrow. Not because you feel better after 2 weeks of blueberries and grip training. I am a surgeon. I have seen what an uncontrolled hypertensive event does to a brain, a kidney, a vessel wall under extreme pressure. The medication is a safety net while your body heals the underlying mechanisms. These steps work alongside it, not instead of it. If over time your numbers improve and you want to explore whether medication reduction is appropriate, that conversation happens with your physician, with your home blood pressure log in hand, with your blood work, with your symptom history, not based on a YouTube video. I cannot assess your individual situation. Your doctor can. What I can do is give you the research and the framework so that when you walk into that appointment, you are not a passive recipient of a prescription. You are an informed participant in your own cardiovascular care. That matters. Studies show patients who understand their condition and ask specific questions have significantly better outcomes than those who don't. Not because the knowledge is magic, because informed patients follow through. They make the changes. They notice the results. They come back and report accurately. Let's bring all four mechanisms together now. Your artery walls are protected by the glycocalyx, damaged by glucose spikes and oxidative stress, repaired by polyphenol-rich foods and blood sugar stabilization. Your arteries stay flexible when calcium goes to your bones, not your vessel walls. That routing depends on K2-MK7, magnesium glycinate, and vitamin D3 working together. Your blood vessels stay open when nitric oxide signals them to relax. That signal depends on dietary nitrates, nasal breathing, bacteria in your mouth being preserved, and regular isometric exercise stimulating nitric oxide production. And your kidneys stop hoarding sodium when insulin levels come down. That requires a fasting window, regular muscle contraction, and time. Four mechanisms, four entry points, one coherent biological system that, given the right conditions, moves in a coordinated direction. Which of these four surprised you most? Drop it in the comments below. I read every single comment, and your answers directly shape what I cover next. If this gave someone you love a new perspective, please share it with them. Informed people make better decisions, and that's the closest thing to surgery I can offer from here. Subscribe if you want more research like this, broken down clearly. Next week, we're covering the one morning habit that research from Johns Hopkins says activates all four of these mechanisms simultaneously. A cardiologist colleague called it almost embarrassingly simple. I'll explain exactly why it works and exactly how to do it. Take care of your heart. It has been working every single minute of your life without asking for anything in return. Give it something to work with. And one final thing. Everything I've shared today is grounded in published cardiovascular research. It is general educational information, not personalized medical advice. Your medications, your history, your individual biology, all of that requires a physician who knows you. Bring this information to your next appointment. Have the conversation. That's the right next step.